Ya, Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi taala wabarakatuh. Uh, Hi guys. Now we will perform or we will discuss about how to using personal protective equipment. Okay, how to using personal protective equipment. In a previous video, we discussed about performing hand hygiene in basic infection control, and now in this video we will perform how to use personal protective equipment, okay, for our safety. Okay, check this out guys. Okay, using personal protective equipment. Okay, what the purpose of using personal protective equipment? First is to improve personal safety. Safety first, okay, in healthcare environment. Second is the second purpose is to comply with occupational safety and health administration and Center of Disease Control and Prevention (CDC). Okay, regulation and recommendation regarding personal protective equipment (PPE). Okay, the last purpose is to prevent exposure to infection and transmission of infection organism based of type of contact expected. Okay, the equipment we will need to perform this procedure is the first we will need a cap. This is optional. Hairpin, rubber band, or both. This is optional. Isolation gown, mask or respirator, protective eyewear, goggle, face shield, and glove. This is the equipment we should need. Okay. Yeah. For preparation, okay. First, you should perform before skill start protocol for all nursing intervention. Jadi you must perform standard protocol, read the standard protocol for all nursing intervention. What must you do? Okay. Second, review the history and laboratory test result for a patient on isolation. The next, you must you prepare is consider the type of care to be provided and consult facility policy to determine which PPE is needed. Next, you must assess the patient risk for infection and consider it when selecting PPE. Okay. The next you must prepare is avoid participating in the procedure or wear a mask if you have symptom of cold or respiratory infection. The last you must prepare is inspect the PPE packaging for integrity and exposure to sterilization. If individually packaged, if you have. Okay. Next, we will solve the video how to using personal protecting equipment. Okay, check this out. Check the video. Okay, wait moment. Okay.
To use personal protective equipment, or PPE, correctly, first
Okay,
determine the types of PPE you'll need based on the patient's
PPE
condition,
correctly.
the type of care to be provided, and facility policy. Depending on the combination of PPE required, plan to put on a cap
Okay,
first.
cap first.
Then apply a gown,
Apply a gown,
mask or respirator,
mask of
goggles
a
or face
respirator,
shield,
Google
and
face
gloves.
and gloves.
Before entering the patient's
Okay.
room, put on your PPE, beginning with a cap.
Oke, ikat dulu rambut. Ya,
If your hair is long,
cap.
comb it behind your ears and secure it back.
Ya,
And
ikat
if
rambut
needed,
dulu.
secure your hair in place with pins or a rubber
Oke.
band.
Kalau rambutnya panjang, jangan terurai. Oke, tuh lihat.
Then
Make
place
the
the cap over your
cap.
head like a hairnet,
Place the
making
cap.
sure that all your hair fits under the cap's edges. Next, put on the gown with the opening in the back.
Oke.
Tie it securely at your neck and waist.
Ya, ikat dengan aman ya. Tie securely. Put in the back.
And if needed, pull the sleeves down to your wrists. If the gown is too small and an extra large gown is not available, use 2 gowns.
Use 2 gown if
To do this, tie the
your
first gown in the
body
front.
is big.
Then put on the second gown and tie it in the back.
Oke.
Now place the mask over your nose, mouth, and chin, and fit its
Place the
flexible nose piece over the
mask
bridge of your nose.
yang menutupi hidung,
Secure the 2
mulut,
top ties
dagu.
behind your head, keeping them above your ears. Then secure the 2 bottom ties snugly around your neck. To ensure a good fit, adjust the mask as needed. If you need to wear a respirator instead of a mask, follow the same steps to put it on, securing it to your head with the elastic loops. Although respirators should be fit tested for each caregiver, adjust the fit and check it as you breathe. When you inhale, you will feel the respirator collapse slightly around your face. When you exhale, you should notice no leakage around your face. Now position goggles comfortably over your eyes and secure them in place with the earpieces or headband. After checking that your vision is clear, make sure that the goggles fit snugly around your forehead and face. If you'll be using a face shield instead, position it over your face and secure in place. Finally, put on gloves of the correct type and size. After inserting your hands into the gloves, extend the gloves over the cuffs of the gown. When it's time to remove PPE, begin with the gloves. Then, take off the goggles or face shield,
How to remove
gown,
PPE, glove,
mask or
Google,
respirator,
gown,
and cap.
mask, and cap. Cap the last.
Plan to do this at the patient's
we
doorway
should
or in
remove.
the anteroom.
Okay.
To remove the
Ini cara
gloves,
membukanya.
grasp the outside edge of the
Remove the
first
glove
glove
first.
near the wrist. Peel it away from your hand, turning the glove inside out. Then hold it in your opposite gloved hand. Now slide an ungloved finger inside the wrist of the second glove. Peel the second glove off from the inside, using it to create a bag
from the
for
inside.
both gloves.
The second glove.
Discard them properly. Next, use your ungloved hands to grasp your goggles by the earpieces and lift them away from your face. Or grasp your face shield by the headband to remove it.
Ini kalau
With
sekali
either
pakai.
PPE, place it in a designated receptacle for reprocessing or disposal. Now unfasten the ties on the gown and peel it away from your neck and shoulders. As you remove the gown, do not touch the outside of it. Instead, turn the contaminated outside toward the inside.
Jangan sentuh bagian
Then
luar.
fold or roll it into a bundle and discard it into a biohazard container if the gown is disposable, or in the isolation laundry if it's washable. To remove the mask, undo the bottom ties and then the top ties.
Bottom
Holding
first.
the mask by the ties, remove it from your face and discard it.
The top.
If you wore a respirator, step outside of the patient's room and close the door. To remove the respirator, lift the bottom elastic over your head. Then lift off the top elastic and dispose of or store the respirator according to institution policy. Finally,
Yeah,
remove the cap
finally,
by grasping its outer
the last,
surface and
remove the
lifting it
cap.
from your hair.
Okay.
Discard the cap in the proper receptacle.
So,
Immediately after removing
immediately removing
PPE, be
PPE, we
sure to
should
perform
perform
hand
hand
hygiene.
hygiene. Okay, that's the video how to using personal protective equipment. What the follow-up care you should do? Okay, perform the skill competition standard protocol for all nursing intervention. Oke, jadi silahkan gunakan ini pada semua skill standar protokol apapun, gitu ya, asuhan keperawatan, pakai apapun, safety first-nya ya. Oke, so second is assess the treat part of the patient body for sign of localized infection, such as dryness, tenderness, edema, or change in temperature or skin color. If need, teach visitor and family member how to follow isolation precaution when visiting the patient and how to use barrier technique for care at home. Okay, teach the family members how to use PPE if they want to visit their family in hospital. Okay, documentation. Don't document the use of PPE. If you nurse progress not, record the procedure performed and patient respond to it. If patient is on isolation, document the tip of isolation in use and patient respond to social isolation. Okay, that's the basic infection control in using personal protective equipment. In next video, our discussion, we will discuss about how to bed making, how to bedding, how to safe patient handling, how to elimination assistant, nutrition, and fluid. So please subscribe, like, comment, and share this video for nursing channel. So we will perform our best video for basic skill of nursing. Okay, see you next time. Wassalamualaikum warahmatullahi taala wabarakatuh. Okay, see you next video.